So how would we know that it is diabetic ketoacidosis? There are few laboratory tests that will help in the diagnosis. Sugar levels. As we have mentioned before, there is not enough insulin in the body, and so the body sugar level will rise. The blood sugar level is usually greater than 250 mg per deciliter. Ketone levels. Ketone level increases in the blood and the urine. It can be detected with a simple urine test using a test strip. Ketones with a level of 1.6 to 2.9 millimole per liter indicate risk of diabetic ketoacidosis. We will also measure the pH of the blood. Now, because of the excess of ketones, which happen to be acidic in nature, your blood will become acidic. For this, it is necessary to have an arterial blood gases or an arterial tap done to investigate. The pH will be less than 7.3 and serum bicarbonate level less than 18 milliequivalent per liter. There are other tests that can be also useful in diagnosis of diabetic ketoacidosis. These include URV. It will also show increased glucose and ketone concentration. Blood electrolyte test, that is potassium and sodium specifically. ECG to look for arrhythmia. Chest X-ray to look for the sign of any infection. So that's how you will diagnose your patient. Now let's move to next section to check how you will treat the patient of diabetic ketoacidosis.